I'm a medical doctor from Uganda, and I have a PhD in international health from the University of Bergen in Norway. So I have been focusing on child health for my PhD work and postdoctoral work now. Child health, improving quality of care for rural children, and policy studies to understand what gaps in implementation exist and how to solve those policy gaps related to mothers and children's health. I'm going to answer this question looking at the situation 20 or 30 years ago and today. So 20 years ago, around 12 million children died every year in Africa and in poor countries. With a lot of effort, with support from the global community, with countries and Uganda working hard and trying to implement programs, we've been able to reduce child deaths to less than 6 million deaths per year. Over those 20 years, which we call the Millennium Development Goal period, we've been able to more than halve the number of deaths in children. And this is really tremendous. It's a tremendous improvement. However, and what we now find is that most deaths in children today in Uganda and Africa are within the first month of life. So of all the children who are now dying, most of them die very, very early after birth. And the older children, we've been able to control their deaths because it's mainly diseases that have been killing them: malaria, pneumonia, HIV/AIDS, which we are managing to prevent. And so we need stronger health system support and strategies to ensure that the very vulnerable children, smallest children, and even children who are born in the most rural areas and the poorest areas, we can protect them and prevent them from dying. In doing this, we need to be clever in the way we do it, by ensuring that trying to strengthen our health systems even further. We've made a lot of progress, but we need to work harder, because in Taiwan here, only about 7 children per year, or out of 1,000 per year, are dying. So compare that to the numbers I've given you for Uganda. So that's the problem, and that's the challenge that we're trying and we want to improve now. My future research will remain within child health because I have a passion for that. I'm a medical doctor and I love to take care of children. And from clinical care of children, I moved into public health, which is country level or population level health care. And I still want to continue public health for children to ensure that, the most vulnerable children, as I was saying, the smallest, the youngest babies, children who are far away in the most remote areas get care. I'll stay within public health, policy analysis, and I hope that I can become a national a health leader, leader of a health program in Uganda, and also even in a global agency, so that I can be able to use my public health skills to improve child health, maternal health. So I did my PhD degree in Norway, and so I know Brundtland, although from afar. I really, she's such a great role model for women and men, and so I feel special, and I feel really happy that I've had this opportunity to be associated with her. The time we spent here in Taiwan over the last week has been really, really nice. I've gotten to see your country by going to all these states, all the cities. We've seen how beautiful it is, but as we did that, we were meeting strong, powerful women who have mentored us in just spending time with them. Everyone that's been part of this program, we thank you, all the ladies, President Sue, and all the women that have talked to us this week. Thank you for this mentorship we've had over the week. And we've had young students as well in the programs, and they've come to us saying they're really impressed and they hope they can also be strong female and male scientists. So I hope we can also mentor students ourselves, and I look forward to contributing to younger women's mentorship.